It's a broad spectrum of diseases. So for as I mentioned, for ET and PV, certainly the treatment goals. Are we able to move on from the control of thrombosis to affecting the disease course? Are we able to find a compound that's gonna stop the progression to myelofibrosis or leukemia? Are we able to find a compound that is less toxic, tolerable, maybe taken for a very long time, and gives the best benefit not only in terms of control of the counts, but also our symptoms, thrombosis risk, survival per se? How are we gonna combine those agents with what already exists? How are we going to sequence those agents? I really much am excited about the approval of the Ropeginterferon in patients with Polycythemia Vera, because for years we were using the off-label pegylated interferon, which we have a lot of experiences with. But I think that's going to open up more space on getting an approved agent. More patients may have access to it, and I think the data about disease modification are really encouraging. I would really love to see less transformation with this agent. Maybe combine Ropeginterferon with novel agents for patients at the purpose of slowing down disease, maybe going after the core of the MPN cells, kind of like what we would like to do. With the myelofibrosis field, there is so many exciting agents that currently exist. Very soon we're gonna move into 4 JAK inhibitors, so that's really gonna be super exciting. Just a little fair how we're gonna sequence them, and how we're gonna choose the best agent for the longest benefit. The add-on compounds, certainly the broma domain inhibitor is a very promising. We'll see how the frontline phase 3 study is gonna come up. And another combinations like BCL-XL, navitoclax, other early phases, they are chipping in and showing us, hey, we can do probably more with this, primarily for patients with cytopenic myelofibrosis, so not so much for those that benefit from JAK inhibitor, but what can we add on to slow the disease progression. And the most exciting and most disappointing is what to do with the blastic transformation of MPN, which we are currently heavily working on, and the preclinical data and the sequencing data. And I know multiple groups across the country are working on to define, hey, what can we do proactively to stop the progression? How do we define it on time? And what do we do about that? Because we know that JAK inhibitors do not have the potential to alter that. So I think those are gonna be the most unmet need and also the most exciting things that's gonna drive the science in this decade.